So without further ado, I will go ahead and turn it over to one of our presenters today, Laura. The floor is yours.
Thank you, and happy to be here today. So I'll get us kicked off for this webinar on supporting families through pregnancy and infancy in rural communities. And we really want to highlight, the state of Indiana has increased its support and investment of home visiting programs as an approach to improving maternal and child health outcomes across the state. And this panel presentation will share three perspectives of different or perspectives of three different home visiting programs that serve rural communities in different regions across the state. So just a quick agenda, we'll have a chance for program overviews from each of these agencies, and we have some representatives from each site here today, and then we'll dive into our panel discussion on challenges, innovative approaches, recommendations, and a few success stories with opportunity for questions. I will hand it over to the team from Union Hospital to share about All Babies Initiative and the work they're doing.
Hey, good afternoon, everybody. I'm Heather Anderson. I am the manager of the All Babies Initiative for Union Health. We serve, I think our service map is on the slide. We serve several counties here in Indiana. We serve Vigo, Park, Vermilion, Clay, Fountain, Green.
Sorry, do you want me to go to the, I think it's the last slide has the.
Oh, is it? Okay. Yeah, no, that's fine. Either way. We serve Vigo, Clay, Sullivan, Park, Vermilion, Fountain, not Green, Edgar and Clark counties in Illinois. We serve pregnant women and their babies up until 18 months old. We don't have any income eligibility requirements and we can serve pregnant moms from conception through the entire pregnancy. We also serve the family as a whole. So we also have a fatherhood coach that we serve our fathers as well. Some of the things that we have through the All Babies Initiative, we have kind of as this shows, we have a peer recovery specialist, we have teen support groups, Dad's Matter Coalition, several different things. Can you go back to maybe the other slide, Laura, please? Yeah. So this is the participants that we've served, the number of participants that we served in 2023 of case management and navigation, a total of over 1,200 participants. So we're touching a lot of lives in a lot of different areas. Some of the services that we provide through case management can be anything from helping the participants to ensure that they get to their prenatal care, all the way to housing, transportation, employment, mental health, helping them to get into mental health services, substance abuse services, basically any need that they have, we're going to serve the families to meet their needs. I don't know if there's any other slides, Laura. There.
I think this is the last one.
There might be one more.
Oh, this one here. Sorry.
Yeah, this is just some different pictures from different things that we've done recently and over the years. That's the team. That's most of the team up there in the top left. We're comprised of social workers, nurses, the fatherhood coach, the peer recovery coach, community health workers, lots of different things to meet all the different needs of the families. Yeah.
Thank you. And I will hand it over to New Hope to talk about their program.
I'm Clarinda Tutterow. I'm the Healthy Families Program Manager with New Hope Services, and our director, Rebecca Llewellyn, is on here too. She's our Director of Family Services. So I am going to speak mainly from a Healthy Families lens, but I will talk, about some of the other programs that New Hope does too. So our family services mission is to promote and strengthen families with respect and compassion through prevention, education, and support. And that there's our link for our website. And then if you want to go on to the next slide, thank you. So Healthy Families has served 495 families with 6,000 plus home visits. Almost 5,000 of those were in the home, in the last year. And then we are still doing some virtual and crisis and other site visits. And then our WIC enrollment is up to 13,000, almost 14,000. Our breastfeeding initiation was at 71.8%. And then our Hope Care Clinic, which is located in Clark County, but will serve others throughout the county virtually too, or throughout the state virtually too. They've scheduled, 1,274 appointments, with 47 of those being uninsured. What Healthy Families does that, we're so proud of is that we do have 15 counties in the southern part of the state, and it's listed on another slide. But we are doing in-home visits for new moms, and we really focus on that parent-child relationship and improving that. And that may look like sharing information with mom about development. It might be sharing information about discipline. It might be sharing information on how to keep her lights on and making sure she's keeping her medical appointments, and just providing resources for the family, however that looks. Writing goals with mom and what she wants to do better in. But really that main focus is that relationship between mom and baby, and that, we can nurture that and support that. And then next slide just kind of shows our offices. So our main office is in Jeffersonville. I'm located like 7 blocks away in our Commons building. And then we have a building in Scott County in Scottsburg too. And then we have, for Healthy Families, we have 4 other sites throughout those 15 counties that we serve. And then I think we're in, Rebecca, you might have to tell me, I think we're in 7 or 8 counties with WIC. And then we have housing, affordable housing, and several of those other counties. So all of those counties where it says now serving 24 counties, that is for New Hope Services entirely, but Healthy Families is in 15 of those. And then our last fabulous page is our Healthy Families team. So we just all recently attended Institute in Indianapolis, and we were excited to all come together. With us being spread over 7 sites, this was the first time we have ever had everyone together at one time. So we took a picture to celebrate it. And then that's a QR code that will help you get to our website.
Thank you. And I will hand it over to our last program, Goodwill.
Good afternoon, everyone. I am Liz Sigler, and I'm joined with Angie Lazaro, and we are directors of operation for Nurse Family Partnership regional teams. This first picture is a picture of our supervisor, one of their clients, and their beautiful child. We can do the next slide. Nurse Family Partnership is an evidence-based home visitation program that's been around for over 40 years. It is a program that pairs first-time moms with registered nurses that visit them in their home or wherever they feel most comfortable being visited during their pregnancy until their baby turns 2. We focus on 5 domains of health. The first is maternal health. So healthy moms receiving prenatal care, screening for preeclampsia, empowering moms to know what to do if she's having signs or symptoms of preeclampsia or other concerns like mental health conditions, how to screen for postpartum depression. And then we also do referrals to services. We want to connect them with their OB providers and mental health providers. We also have a team of mental health clinicians that help us bridge them to mental health services within the community as well. The second domain is child health. So we look at the health of the baby, thinking about are they meeting their prenatal, or are they meeting their well child visits? Are they meeting milestones? Are they up to date on vaccines? And then the nurse works with the mom on her attachment to the baby and how she can be the best mom that she wants to be. What does that look like? What are her dreams for that? We work on environmental health, so screening for hazards in the home and supporting the mom through those concerns. We work on relational health, so screening for IPV, but also what does trust look like? What would a healthy relationship look like? What kind of relationship do you want to have, because you know that your baby's watching you in those kind of relationships. And then my personal favorite domain, which you might not think about with nurses, we work on the socioeconomic development of the family. So even though you're becoming a parent, you can still have big dreams for your life. And we support families in going back to school, getting a job. We can also do referrals for things like other social drivers of health, like housing and transportation. So our three overarching main goals are healthy mom, healthy baby, and increase socioeconomic independence of the family. Um, and then in addition to that, our nurses are collecting data throughout the program. So our program shows that moms are getting high school diplomas, getting increased education. Babies are more likely to be up to date on vaccines, things like that. In addition to those outcomes, we have community health workers and mental health clinicians, which Angie will talk about later. They provide support to both families and nurses so that if clients have needs that the nurses aren't sure exactly how to address, the community health workers are skilled at connecting them to care outside the community or within the community outside of Nurse Family Partnership. And our mental health clinicians serve as a bridge with short-term therapy until they're able to have a relationship with a long-term therapist within their community.
And this is our map, our service area. So there's 3 implementing agencies in Indiana, but we're really happy to say we now cover the entire state. So it's either us or 2 of the others listed here, but we're really excited to share that.
Okay, go to the next slide. And these are pictures of our team. The top left-hand corner is our nurse of the year. She is serving in Tippecanoe County, and that surrounded by her is her nurse, her team members, nurse supervisor. The bottom left-hand corner, we had a retreat in the fall to help refuel our nurses so that they can get back out to serving clients, but also take care of themselves. And that's a picture of our whole team. The top right is some nurses doing community outreach around Vigo County. And then the bottom right-hand corner, that is some of our nurses that are serving on the regional teams, so serving mostly rural Indiana.
Thank you. So we will dive into some discussion questions here, and I'll stop sharing my screen so we can see everybody, but we'll talk through some challenges, innovative approaches, and recommendations from the home visiting programs. Okay, so to kick us off, what are some current challenges that families are facing in rural communities? And I'll put that question to New Hope to start us off here.
I'm sure. I would say one of the things that we have realized is the lack of healthcare opportunities in some of these rural counties, and what has been termed an OB desert. And it's not even just the OB piece of it; it's the reproductive health. It's the that moms having access to birth control, so that they can control that on their terms. And so we do have concerns about that. It's in our rural counties, we have areas that don't there's just no OB. They have to drive 45 minutes to see an OB. They have to drive 45 minutes to pick up birth control. I mean, it's definitely a challenge. And some of the other things that we're dealing with is telehealth. And telehealth is great, but if you don't have internet and you live 30 minutes from town, it can still be a challenge. And we're able to fix that a little bit, but it's still a concern. Transportation is definitely a huge issue with our families. It's a barrier. Families aren't able to get to where they need to go, or if they have a friend take them, sometimes it's a car seat issue. They've got to put 3 car seats in the back, or the car only holds 3 car seats and they need 4 car seats. And or they can take a bus, but you've got a mom with a car seat here and a baby here and another car seat, and even public transportation isn't working. So transportation is absolutely a barrier. And then let's see, what else did I have on here? Just the overall lack of resources in the rural communities. we know we've been through a pandemic recently. We know we've been through, the issue of not being able to work or being able to, access some of those local resources. And it's still, we say families are drowning, and it really is. It's sad when we go into homes and we see that what these families need, and we just don't have the tools, the resources to give them. It's disheartening. So those are some of the challenges that we're facing at New Hope.
And for Union Hospital, what are some of those challenges you're seeing?
We actually see the exact same challenges as well. In addition to that, a couple other things that goes along the same lines of the limited time and resources. We do have just a limited amount of time with our families, a very limited amount of resources. But it's also trying to build trust with the families, with the community, with the providers. That's difficult. You're as a home visiting program, we're asking to go into the most sacred, safe place that a family has. And it takes time to build trust with our participants and to build trust in the community as a program as a whole, that we are here to serve and support and help, and that we're not here to do any harm. And so you have to, we have to work constantly towards trying to achieve trust and rapport in very short amount of time. And then also with providers as well, just gaining their trust in order to get referrals for our program. And that just takes time sometimes. So they need to be able to see positive outcomes and positive things that come, from the program. So the other really big one is affordable housing, and housing at all, really. But definitely affordable housing for our families. It's getting so expensive. If they can find housing at all, it's so expensive. It's very difficult for them to afford it. And I feel like, as we all know, if you don't have a safe place to go lay your head, it's very difficult to think about anything else. Prenatal care, how I'm going to care for my kid, you have to have a safe place to go. So that's a huge challenge for us, is housing for our families and for it being affordable as well.
Thanks, Heather. And Goodwill, what challenges are you seeing in the community?
Yeah, so many of the challenges that the other programs discussed also we see. And just to add, and I know the other programs experience this too, timely mental health treatment is one of the biggest things. And this is really across the state, but we see it even more in our rural areas. When families say they want help, that's such a critical time to get them help right then and there. And if they have to be on a long wait list, or some of the other barriers we discussed, like transportation or not being able to utilize telehealth, they may kind of fall out of that window of readiness, and we miss that opportunity. So that's really big. We also see some limited job opportunities and maybe lower paying job opportunities in some of our regional communities. Along with that, lack of nutritious food options. And just to kind of add to that, building trust in the community, one thing we found to be really important is to hire nurses that live in the communities, because we really think and that this helps build that trust. They'll know some of these resources and some of these maybe workarounds to get clients the support that they need, more so than someone who's traveling into the county to support this family. So we also find building trust can be challenging at first, but we work really hard to really meet the client where they are, adapt to what they need, and just be open and non judgmental to be able to support them through all these challenges.
Thanks, Angie. And I think that leads us nicely into thinking about what are those innovative approaches that your programs have implemented to meet the unique needs of families in rural areas. And I'll hand it back to Angie and Liz to kind of build on more of those innovative approaches.
That's kind of perfect because I kind of ended with maybe an innovative approach, right, of meeting clients where they are. Home visiting as a whole is innovative. So all of these programs are meeting the families where they are and adapting, tailoring to their needs. Meeting them in the home really eliminates a lot of the barriers we talked about, like transportation and telehealth. Um, Other innovative things that we've done as an organization is providing activities with the families. So trying to get families involved in maybe like a community event with us, or even bringing an event to them, like painting parties or anything like that, so that they can build community within their county as well with each other. We have a variety of teaching methods. So we have, handouts, we have videos, we have just dialogue, conversation starters using motivational interviewing to really kind of work through some of these challenges and barriers that the families face. Liz mentioned our mental health program. That's really innovative, even for NFP. So that's like in addition to our model, we're able to have mental health clinicians that can provide telehealth services across the state for our implementing agency, and they can provide services until we can get that mom into outside support. So it's kind of a bridge program. So it's short-term care, and they're full. They're on a wait list often. There's definitely a need across the state for that. We have support groups. So one that's pretty neat is a Spanish speaking support group in our Southern Indiana area. So that's been really great. We even had a Spanish graduation for those families and invited even current clients who speak Spanish to come. And again, it's building that community within the county. Um, I kind of mentioned activities with the families. We also have a parent advisory group where we bring clients and graduates in to kind of come up with ideas on how to engage families. And then um, to overcome transportation, depending on funding. So this, kind of comes in waves, but sometimes we're able to offer gas cards. We know some in the rural counties there may not be Uber or Lyft. There may not be a public transport system. They might not have a car, but maybe they're relying on someone else. So by providing a gift card, maybe they can put gas in their car or provide it to give it to the person who's driving them around so that they don't feel like, they're taking advantage of them. So that's something that we are sometimes able to do. And then last, I just wanted to mention, Liz touched on it too, just our partnership with Goodwill. There's a lot of support through Goodwill, like our adult high schools called Excel Centers. They work really closely with adult learners to get their high school diploma, and they're adaptive too. So they have different hours, they have childcare. It's really supportive to the families, and they help with transportation as well. And then there's other Goodwill programs too that could help.
Thanks for sharing so many great approaches being taken. And Heather, would you like to speak on the innovative approaches that your team has been working on?
Yeah, we have several different things that that we've worked on. We have a pretty high teen pregnancy rate here in our area, and so we've created a teen pregnancy group that meets monthly, and just the teens go with one or two of our staff members, and it's a supportive group, kind of like it would NFP was talking about. It's bringing different communities together in the community, and they support each other as teens. We provide food there, and then education of some sort, have a guest speaker come in and talk with them. But really the biggest part of it is that they get to be together in a non-judgmental space as teen parents. The mom, the dad, and the baby can all come, or pregnant teens can come. um, that's been really successful for us. We also have a very strong fatherhood program that works really well with our dads. Our fatherhood coach has created some classes specific to dads that have worked out really well. That really teach everything from how to hold the baby properly to changing the first diaper to, the car seat. So that's worked out well for us to engage fathers. Another thing that we do have something called the Healthy Homes Initiative, which has been very successful for us. And it's a program where a couple of our staff are certified healthy homes people, and they go in and basically just are in the home to find safety hazards. Could be lead-based paint, could be we don't have a smoke detector. Um, they also bring environmentally friendly cleaning supplies, and they can bring a vacuum. These are things that a lot of our families don't have already, and they're provided through the Healthy Homes Initiative. Um, that also has been very successful and pretty exciting for the families when they're able to learn how to have a safer home environment, and then also get those cleaning products for free because they usually can't get those. Um, and then we really work really hard to just build a positive support network around our families. We sit down with them at the beginning and then also every single time that we visit, just to talk about what their specific goals are. Um, and then we base our work with them on the goals that they've come up with. So building that positive support network all around them. So that way, when we leave, they still have all of those positive people there with them to support them and keep them going after the 18-month mark when baby graduates out. Um, we just do a lot of active listening and a lot of referring and supporting. So my colleague, Michelle, is also on the call, and she was going to talk about a couple other things that we do as well.
Hello.
Hey.
So some of the things we found that have been mentioned before, one thing is transportation. And what I quickly found with the families we serve is they often don't realize that their insurance through the state will cover transportation to the OB appointments or to the well child visits and to the WIC office. And so when we're missing appointments at those offices, or we just have a concern about getting there, we take the time to model how to set up that transportation through the state programs, because of a lot of our families are used to texting. They're not comfortable with calling. And so modeling that on a three-way call has been very successful in getting our families to the places they need to be. And when we're calling the insurance, again, with the families right there beside us, we're talking to the insurance about the rewards programs that the family can qualify for. So those gift cards or the monies that are allotted to them for going to those OB appointments or taking their child to the well child visits, things that our family didn't even realize they were eligible for, we can educate on and get them connected. And then we also have a lot of families who move out of our service area. And it's certainly hard to see them go once we've established that relationship. But our next step then is to get them connected in the community that they're headed to. So finding healthy families, if it's here in Indiana, finding nurse family partnership, if it's that first pregnancy, or parents as teachers in Illinois, finding an agency that can carry on this work and be the cheerleader for these families that we're serving becomes a big part of that discharge process for us.
Thank you, Michelle and Heather, for sharing about what your program does and support how they support families. Clorinda, would you like to share what innovative approaches your program has been implementing to support families?
Sure. So a couple of things that we feel are innovative is our Hope Care Clinic. Again, it's our clinic for reproductive health, and that is for men, women, adolescents. They do provide virtual options, and they also provide prescriptions, contraception, birth control, and it's not on a monthly basis. I believe the last time they told me, unless this has changed, the last time they were able to give like a year's worth of birth control at a time, so that the family wasn't having to come in every month or even every 3 months to get that. And so we do have an in-person clinic here in Jeffersonville in Clark County, but we are able to serve other counties virtually that way. So we're pretty proud of that. One of the other things is that in all 15 of our counties now, we have a mental health clinician that our staff have access to. And so they meet with that mental health clinician once a month for an hour to go over the things that they feel are trending or things that they're dealing with when they meet with the family. So it's kind of could be, that secondary trauma that they're dealing with when they're going, family after family with these crisis visits. Or it could be something that, so our clinician will read through the notes and she'll see some trends. I see this, you have a couple of families that are handling schizophrenia, and then the clinician can help support the staff person and give information on how to, not necessarily address it, but how to work with a family that is dealing with something like that. So having that mental health clinician has been fabulous. We have two. We just had one leave, and then we're in the process of hiring another one. But so we have three that will work together in our 15 counties, and they come up with trainings every other month to kind of address any trends that we're seeing as far as serving the families. And our staff look forward to that. They're like, oh, I've got something I'm dealing with this family. I need to talk to the clinician, and that's been going really well. We're excited about that. Transportation in healthy families, we can provide transportation for our families. Sometimes that is taking them to the grocery store to get some groceries. Sometimes it's taking them to their OB appointments, to child, the appointments for the child. Sometimes that's taking them to the WIC office to get recertified, or that's taking them to the FSA office to get, Medicaid or food stamps or whatever it is. So we can provide transportation. We try to limit it to like what goals the family's working on, so that we don't just show up. Mom says, hey, I need to go to the grocery store today. But sometimes families don't know how to maximize their SNAP benefits, and so we can take them and kind of help budget and grocery shop and do that during one of our visits. Or how to use the WIC card, for the first time. We'll help them do that. And I know WIC does that too. But we are able to provide transportation, and we don't provide car seats. The mom have to have the car seats, but we are able to provide transportation. So we know what a huge barrier that is, and we're excited that we're able to offset that a little bit. And then one of the most recent things that we've done is we bought tablets for our sites. So we bought tablets it was through a grant. And so we bought 2 tablets for each of our sites that staff can use for translation services. We realize that there are a lot of families that we can't serve because we don't speak their language. And that's a problem. That's definitely a barrier. This service that we used, it's called Affordable Language Services, but we can set up the tablet in the family's home and have call the translator, and a person will be FaceTiming or virtual. It's the actual face of someone that will translate during the visit. And we're establishing trust with that family as the home visitor, so they trust us to allow this other person to sit in on the visit. And we've been able to serve quite a few families that way. And right now it's just been Spanish-speaking families, but we have access to a lot of other languages. As we see those languages come in and we can serve those families, then we know we don't have to worry about an interpreter. We can just call up the language line and there they are. So the biggest challenge with that was the very first visit was trying to connect to Wi-Fi. When you can't access the Wi-Fi for the translate, it took about 45 minutes for the home visitor to actually get the Wi-Fi going. But she's been doing it now for about a year, and it's going wonderfully. So we're very excited about that. And we know we've been given some more grant money to, I don't know, expand that service. Right now we're good. We've got plenty of tablets, and we've got the home visitors that are willing to serve the families. But we know that grant money is there to expand on that. So we're pretty excited about that.
Thanks, Clarinda. And always love hearing all of these approaches that the teams are taking in such a great way to support families and to really meet those unique needs that you're seeing, especially in these rural communities, and thinking through those. So the next, kind of question is what recommendations would you have for healthcare providers serving in rural communities, knowing that we're hopefully connecting with a variety of healthcare providers here, and what would those recommendations be? And I'll hand it back to you, Clarinda,
and I'll take it. So our biggest recommendation would be just refer the families. A lot of times when we get a referral from a pediatrician or an OB, or it's a family that is deep in the crisis, and we'll take those. Yes, absolutely, we will take those, and we will do everything that we can to support that family. But refer all of them. our goal is prevention. So if we can start working with the family sooner and, prevent the major crises that might happen along the way, then that is our goal. So we have the capacity right now to serve quite a few families. And so we would, ask my recommendation would be that you send them our way, and then we'll kind of juggle them from there. Right now we have the opening, so that would be ours.
Thanks. And I think a big point across the state, we have home visiting programs in every county. So definitely, I think refer is an important step in that process. I'll hand it to Goodwill.
Definitely agree with Rebecca's recommendations. Additionally to that, you may have heard of Health First Indiana. The legislator allotted money to go to local health departments, and those health departments identify their key challenges in their community that they want to address. So, engaging with local health departments to see how our goals align. And if you're a maternal child health home visitation program or a different kind of program, there's definitely an opportunity to collaborate with local health departments so that we have the largest reach and service. And can avoid duplicating the same work. We can start working towards being able to serve more people.
And the only other, well, not the only other, but another recommendation, maybe just to make sure that the families are being included and at the table for decision making, to even assess challenges and barriers and what works well for them when coming up with new things to try, or to implement, just making sure that the families are involved.
Thank you for those recommendations. And wrap us up with Union Health, Michelle and Heather. What recommendations would you have for healthcare providers in rural communities?
If I may, Laura, this is Hisham. I'll chime in on the recommendation and just also provide a little bit of a recap in terms of hearing from all of the programs. Our common approach through home visiting is working with the families, and we seek to create opportunities for them by meeting them where they are, meeting them where most convenient, and then walking alongside them. But at the root of it, we start down this journey to tie it to Healthy Funds Indiana to tackle infant mortality. We are focusing on reducing a lot of the disparities that our rural communities tend to see much more than many of their urban counterparts. But that doesn't mean that there are not resources available in those communities. And the idea is, and what all of us are doing is creating networks locally, whether it's the local church, whether it's the local schools, it's leveraging what we have. You've even heard us speaking about creating a network amongst ourselves and referring to each other. So, as a provider listening in, yes, we work close with you to take those referrals, but we are working on the social determinants of health, those drivers that are impacting your outcomes, but you may not know how to tackle or may not sure that you have time for or your teams have time for. That's where we can help you because we do build tailored care plans. So do you. We are working on some of the challenging elements to get to ultimately that better access, better quality. I'd also wrap up by kind of going back to something that came up earlier around OB deserts. So, in working with a lot of the clinicians, yes, there's a maternity challenge element with OB closures, etc. But for a healthy pregnancy, a lot of the planning preconception can be key. A lot of the prenatal access is also a component. So these are things that across the entire state, each and every one of us is working with our local partners to be able to tackle. So if these are things that are still gaps for you, reach out to any of us. And there are a lot of lessons that you can hear and we'll be able to happy to share with you to leverage what's available, whether it's a rural health clinics, even if you're in a county where there's no hospital, there are ways we can get to those healthy pregnancies, healthy families, and ultimately get healthy together. So I'll just wrap it up there and trust we go with some success stories to next.
Thanks, Hisham. And I think, a key message there is that collaboration and partner. We're all in this together, and how can we strengthen those partnerships to better serve families? So, as thinking about serving families, we wanted to share some success stories from programs to really highlight, the great work that's being done and the results from these programs as well. So, I will let Goodwill share one of their success stories here.
Thank you, Laura. In order to get this success story, we reached out to some of our rural nurse home visitors. And so I'm going to kind of read it because I want it to be, from her and her words. But this is a client we were able to serve. And you'll be able to see through this story a lot of those challenges and barriers that we mentioned earlier. She was able to overcome. And it's really exciting to see, like, yeah, there are challenges in rural areas, but there's ways that we can help these families get through. So, this was a story of a client who was fleeing domestic violence and found herself living in a small rural town. She had no family, no friends, did not even have a home, no transportation. She was really starting over. She was also found herself living in a community where she felt very isolated culturally. The first thing she did was get in contact with a domestic violence shelter, and this helped get her support started. She also joined a local church and met people who were really able to help her because they have lived in the community and they know the resources and they know people to get connected with that could help further her even more. Through this support, she was able to rent a trailer, started working a job that was local and family owned. Through the community that she met, they gave her rides to work and appointments, and like we mentioned earlier, for her, these were 30 to 45 minutes away that these families were volunteering their time to help support her through. And then programs like all of ours, home visiting programs, WIC, and other local community programs were able to wrap around her and provide her with support like getting things for her new home, healthy foods for her and then her baby, and so much more. I think it's key for this story of that networking and relationship building and just finding those resources that are there in the community were just key to her success. She stated she never dreamed she would love this small town, but she loves where she is and the people she got to know, and now this town feels like home.
Thank you so much for sharing that story. And Union Health, would you like to share a success story?
Yes, that was a wonderful story. Thank you so much. So we have had the privilege of seeing so many wonderful families, and we are starting to really see an influx of families that do not speak English. And the family that I'm currently speaking of, we've worked with for about 2 years. They're from Haiti, and we have a rural community that is starting to see more people from Haiti moving into that setting. So again, we've served this family for about 2 years. We first met her when she was 23 weeks pregnant at her first OB appointment. And the reason that first OB appointment was later than normal was, first of all, she didn't know where to go for OB care. In her rural community, that hospital does not deliver. She didn't know what doctors were an option because of the language barrier. She had trouble getting that appointment scheduled for that first OB appointment. And then transportation, because the family didn't have a car, was an issue as well. And so we quickly learned that our iPad with translation services was a lifesaver as well. It made a tremendous difference in making this family feel more comfortable and at home and heard. The home visits proved to be a little bit challenging initially just because of the internet services in the home with the iPad, but we got through that. We quickly found you just needed to allow for at least a couple of hours for a home visit and a lot of laughter, because even with the translation services, those calls often drop. And so you might have 3 or 4 translators with you during a home visit setting. But the barriers that families face when English is not their first language is tremendous. And I have learned so much in working with the family. It was probably the second visit that I was out at the home, and the mom said, I need to know how to get my 8-year-old son enrolled in school. She didn't know what school system he would be in, what elementary school he would be in, those kind of things. And so through contacting the principal and going to the school with the family for a tour, we were successfully able to get him enrolled in the elementary school. And that gave mom a lot of peace. She was very stressed about her son not being educated here in America. That was very, very important to her. He already spoke Haitian Creole and he spoke French, but he didn't have the English component yet. So that was very important to the family. As we were moving along with her pregnancy, where we were able to educate on safe sleep and provide a pack and play for the family, as well as that help them find a car seat. Even though they didn't have transportation at that time, we knew with Medicaid transport, we were going to need a car seat, of course. And then this was the first year that they had experienced snow. So helping them access additional blankets because they were freezing is what they were telling me here in Indiana, absolutely freezing. So many times that we just laughed and just connected with the different things that were happening. As we went along through our relationship, the family decided there were so many people living in their home that they would prefer our home visits occur somewhere else. Again, they didn't have transportation. We're talking a rural community. The only thing that was even close was a local church. And so I contacted the church with their permission, and the church allowed us to meet there in the church setting, which proved to be a great blessing because probably a month later, the family was asked to leave the home that they were living in. And so now we have a Haitian family that is homeless. They are both working. The dad was working night shift, the mom was working day shift, but they did not have a place to reside. And the church ended up coming through in a major way. They brought in a camper for the family to stay in until we could find a place for this family to rent. So this local community and this church especially have wrapped around this family in assisting them in all the things that come up. I mean, setting up a new home, beds for everyone, furniture, food. I could go on and on. There have been so many things that have come up again for this family, and they have just persevered with such joy, and they're so grateful for any assistance that can be given to them as they walk through the challenges. We've worked through international license issues, driver's permits, ending up at the wrong pharmacy. Per Medicaid guidelines, they needed to fill the prescription at one certain pharmacy in town, and the family used the other pharmacy. So figuring out all those little ins and outs that are challenging for any family, but especially a family whose primary language is not English. Um, we've had a lot of laughs as we've gotten through those journeys.
Thank you so much for sharing, Michelle. That is a lovely story and such a example of success with, um, the relationships that can be built in rural communities that can help support families as well as from the programs too. And hand it to Clarinda for a final success story.
How am I supposed to follow that? Wow. So ours is, to me, it's a similar success story. This family that we actually had her for 5 years. Within the last couple of years, Healthy Families has changed their guidelines where we can keep families in a little bit longer. It used to be when they had 3 years of service, they had to graduate or age out or transition on. But if we feel that the need is there for them to stay in until 5 years of service, we can do that. So this particular mom, when she enrolled with us, was in a abusive relationship. Was living with her abusers and her and his friend in the an attic top of a farmhouse, and it was she felt trapped and did not have a good relationship with her family, and shared that Healthy Families was her only support. And for us, that's scary, to think that our goal is to work ourselves out of a job, and we want families to realize that there are other supports out there besides us. And so it's a little daunting when you realize that we're all the families have. And so by working with this mom, she, through the course of her participation, ended up, leaving her abuser, getting a full-time job, managing daycare, um, buying a car, um, you know, getting in her own apartment, paying off her car. I mean, it's been 5 years of success after success after success. It's been wonderful, and we see this throughout the families that we serve often. I think what makes this one stand out is that she wants to share her story. She knows that she's broken some generational cycles here, and she wants to share her story. And so for New Hope, she participated in a video, and she was interviewed, and she was honest, and shared the struggles that she had gone through and where she is now successfully. And we have a breakfast here in a couple of weeks for New Hope, and we're sharing the video, and she's coming to the breakfast, and she knows the successes and the success story that she is, and she's wanting to share that so that her story can hopefully help someone else. So very similar to what everyone else. That's why we do this job, is to see these success stories, and sometimes we don't get to see it in the moment, but you get to kind of look back and like, hey, I had that mom, look at her now, and that's great. But that's what I love about this story, was that the mom was like, yeah, sign me up, I'll do a video, I'll share my story. And we don't, there was some moms that we asked and they weren't ready for that yet, and but this one was. So I just thought that was kind of it spoke to us. So good job. Yeah, we all have similar stories. Yeah, it's great.
Yeah, thank you. And I think it just speaks so much to all of the great work that the programs are doing, and the families are doing, and the communities are doing. And just very impactful to get to hear all of these stories. So thank you. And I'll thank all the speakers for sharing today and taking some time to talk about your program. And in our last 5 minutes here, open it up if there are any questions.
I have not yet received any questions, but I'm happy to go ahead if anybody wants to ask a question verbally, or if you'd like to put that question again in either the Q&A or the chat. We've got our eyes on both. We are happy to take questions at this time. Or if any of the programs have questions for each other, please feel free to ask questions too.
I have one thing that I forgot to mention, and I think could be valuable to all home visiting programs. When thinking of job opportunities, don't forget about the Goodwill retail stores. They're throughout the state, and it's a really great opportunity as a starting point to get job experience. And there's coaches that can help you kind of work towards your next goal. So it's not only for NFP clients, so any home visiting participant, can go and apply at the Goodwill retail stores.